So 2 years ago, what we decided is to actually start supporting a project with our partner CASEC and working with secondary schools. We started off working with 10 secondary schools, and it's culminated in this year working with 14 secondary schools. The idea of the project is to use a number of volunteers. We go into the schools and we identify a number of student peer health educators, and we set up a weekly health club, or we build on a club that's already in existence, and we run weekly sessions educating children about HIV and AIDS. So within those sessions, it's an opportunity to have an open forum where children can discuss potential issues that have been very taboo before, and they can discuss issues about HIV and AIDS. They can learn about contraction, they can learn about things like life skills, about how to actually, about relationships and how to look after people who've got HIV and AIDS, but also explaining to people, I mean, many girls over there suffer from harassment from boys and don't really understand don't have the ability or are not empowered to be able to say no. So it's also about trying to help them become more empowered in saying no in those situations. So the sessions themselves, they cover different topics around it, and what they do is they teach it in different ways so that they try and make it interactive, they try and make it fun. So sometimes the education may be in the form of having some kind of sports tournament. Sometimes it may be that they go on a school visit and they visit perhaps another group, but they try and make it quite interactive. And the idea of having the student peer educators is that actually, if you're educating people and it's being done by your own peers, they believe it has a much bigger impact than actually asking teachers to educate children around that. And once those student peer educators are trained, they are then responsible of running the weekly sessions with the support of the CASEC staff and volunteers, but they're also responsible of, outside of those health club sessions, of talking to other students about it and trying to encourage more people to join the health club and to generally just raise awareness. And it's really good for the students, because actually it's quite empowering for them that they're suddenly given responsibility to do something, and actually they feel very positive about themselves. They get an opportunity to stand up there and public speak. They get an opportunity to network, and they really kind of endear to this whole new role where they're quite responsible. I went to a really lovely school called Lorien School, and I met the health club guardian there, who I believe was the head of the science, and I met some of the students there, and they were just incredibly enthusiastic. The programme had not been running there for very long. What he did say, the club guardian, is that sometimes it has been hard to kind of get the support from the headmasters at the school, because there was scepticism about sort of another NGO coming there, but I think now there's a lot more acceptance about the positivity of this programme that CASEC are offering. And there was, the students were very enthusiastic. They liked their new role as health club guardians. They felt very supported by the club guardian themselves, who was a teacher there, and they said that, suddenly that people were able to talk about the kind of issues that had always been very taboo, not only amongst their peers but also with their families, and they have the opportunity now to spread the word about HIV and AIDS education and take it home to their families, take it home to their communities, which is something that's not been done before, and they see it as very positive. And they also talked, when we were over there, about trying to take the project out to groups of youth that couldn't be reached through the programme, children that living in orphanages, and they thought that was really positive, that they can actually do something so good that to these groups of people that potentially aren't reached by a lot of NGOs by these kind of programmes. I think that what we've noticed over the last few years is that suddenly there's been a growth of schools actually approaching CASEC themselves, wanting to actually take part in the programme. Traditionally, when they first started, schools were quite wary about being involved in it, but now we've actually got schools queuing up to be involved, and so the way I'd like to see it happening is in the future that more and more schools get involved. At the moment, we're working with around 14 schools annually, And on average, the programme is run in the schools between sort of 6 and 12 months. But what I'd like to see in the future is that actually this programme goes out to more and more schools, and perhaps with government support, because I think it's a fundamental right of these children to be taught about HIV and AIDS.